My name is Andrew Brower, so I'm from Springfield, Missouri. I'm a hospitalist here at UNMC in Nebraska Medicine. I did my undergrad in Missouri, and then I also came back and did residency in Kansas City. So technically, I'm family medicine board certified, and so I was going through residency, and I had a very, very intense but awesome residency experience in Kansas City. And you know what I found was that I love working in teams. I love being in the hospital environment. I love the quick pace. We had an open ICU, and I just loved being in the hospital because I felt that's where the action was at. So instead of going the traditional family medicine route, I chose to pursue a hospitalist career, and I've never looked back. When I was 14, I was diagnosed with leukemia, and so I went through chemotherapy. I had treatments every few weeks, and I was in the hospital setting a lot, and I kind of saw the great nurses and doctors who impacted my life, and then also I had some not so great ones. And so it was really from that experience where I got to see the other side, the patient experience, where I found that I really wanted to help people, and that's kind of the traditional answer. But then I started volunteering with organizations for kids with cancer. I started doing camps, and I really loved that. I love the hospital setting, and I really wanted to get into patient care. When I first sit down with a patient, I'm very informal, and so I like to get to know them. I like to connect on a personal level, not a doctor to physician, but more just a person-to-person level. I'm very straightforward. I've got my laid-back Midwest attitude, and so I like to kind of feel out how they're feeling and how they're just perceiving their environment, and kind of feeling them out before we really get into why they're in the hospital, and how we can hopefully get them feeling better, then get them back home. Academic medicine appeals to me because I feel we're all lifelong learners, and I want to continue to grow and evolve as medicine does. And in the academic environment, I feel that's the best place to be on the cutting edge of medicine, to continue to push yourself and your boundaries in many different ways. And so coming from the community hospital experience, I'm looking forward to just get better and better and learn with my residents, students, and continue to be a student myself. When I'm not at work, I enjoy staying active, playing soccer when I can, but also powerlifting, which is what I transitioned to in medical school when it was harder to get a bunch of guys on the field together. In addition, I love going out, hanging out with friends. I love traveling, going across overseas, to different countries, and I look forward to expanding on my travel book and staying physically fit.